Hey Acupressure and Wellness fans, it's Diego Roy and I'm here doing a follow-up video just to show you my technique of how I treat intercostal trigger points. So knots that form in the intercostal muscles between the rib cage, between the ribs of the rib cage. So I'm zooming in here and we take a look at the rib cage here, 3 shots of the rib cage. And you'll see on the image to your left, the muscles right there of the rib cage, right? There's muscles that connect the ribs, all the ribs of the rib cage, the 12 ribs on each side. And what happens is when you have asthma, bronchitis, OCPD, or other respiratory conditions, or you catch a cold, during the winter or spring months, right? Catch a cold, you cough a lot, sneeze a lot, wheeze a lot. What happens is the muscles in the rib cage work overtime and they begin to shorten and tighten. They develop knots and then they compromise how the rib cage moves. The rib cage should move like an accordion. Look at a little child and you see the little child when they laugh and sneeze and cry. The rib cage is so free. It's so supple and limber. It just moves so freely. And as we get older, we tend to lose that, and we want to maintain that. And so, here's a technique that I use. Basically, it's a little harder to do it on yourself. So, if you have a family member who's struggling and is wheezing, breathing hard, or you notice gets relapses, as I mentioned in the other video, the bottom third of the lung doesn't, the used air, the dirty air doesn't get exchanged when you have a limited inhalation and exhalation ability. And so by loosening up these muscles in the intercostals, we allow that accordion effect to be restored in the rib cage. My technique I use will be working. For example, I'm going to show you on the right side of this the rib cage here. And what you do is you put your left hand under the individual's rib cage, the right between the bed and the ribs, and then you use your right hand, and I like to use my fingers, my 3 or 4 fingers, and I start on the bottom of the ribs, the bottom, okay, starting in the midline, working my way out to the side, go up 1 space, working my way out to the side, go up 1 rib space, working my way out to the side, go all the way up until I come to the clavicle or collarbone, working all the way out to the side, using 3 or 4 fingers in the intercostal spaces. So it all depends on how big your patient is. If it's a child, you may just use 2 fingers. If it's a big adult, maybe you use 3 or 4 fingers. But you can see how the fingers would fit into the intercostal spaces, right? And you start off in the sternum, the midpoint, work your way out, right? And you're holding each point, each part of the muscle you're holding for 12 to 15 seconds, and you're kind of feeling for stiffness, tightness in the muscles. One side of the rib may take you 15, 20, 25 minutes to do it nice and thoroughly. But what you can do is when you do this and you do a good job, what happens is you can prevent someone from getting a relapse. They can get a cold. People who get colds and they get relapses. People can hang on to remnants of a cold for decades, believe it or not. So you want to really clear that out. You want to strengthen them. You want to give them back their breathing ability, capacity, and this is a great way to do it. I had a personal experience where I had a bad influenza when I was 42, and it set me up for a series of colds that followed. When I had a deep tissue trigger point massage treatment, I had 2 on my chest, my rib cage. That was it. I was restored. I was strong, and the relapses stopped. So I hope that helps you. If you have any questions for me, please leave questions for me and I'd be glad to help you in any way I can. Again, this is Diego Roig with Acupressure and Wellness and talking about my technique for intercostal massage, which strengthens the immune system. Mahalo.